And in Marketplace Medical today, Cameron Fontana had a chance to find out about some techniques for hand therapy. That deserves a hand.
We are at the Hand and Arm Therapy Specialist adjacent to the physician's office at Hand Microsurgery Associates. With me is Dr. Kobus. How are you doing, doctor?
Very well, thank you.
Good. Tell us, this is a remarkable room right here for hand therapy. How in-depth is this to getting yourself in a position where your health is where it needs to be?
What makes this unique is it is adjacent to our offices, and so we frequently will see patients along with the therapist, and we can kind of review their therapy, we can review their plan of therapy with the therapist, and there's a lot of input and feedback from the therapist so we can make good decisions as far as further therapy.
So let's move right this way. I really love this section over here because everything is so visual. It seems like there's something for everyone to get them to the point that they need to be. What are these right here?
This is various substances that we use for desensitization for people who have injuries to their hand that involve the nerves. Sometimes that could be quite hypersensitive to various cold or heat sensations or to touch sensations, and this goes anywhere from substances that are very soft up to more coarse and firm and larger objects to kind of give them a better sense of how to use their hand and to desensitize their hand.
So you have everywhere from the soft, where it's very soft and fluffy, but then you come right over here and it's, oh, you can definitely feel all the little rocks within there. I love it because it's so visual and it's more interactive than just anywhere else where I think of hand therapy. It's maybe not as exciting as this.
Well, it's various gradations, and these are things that we actually use to teach patients what they can do themselves at home, because hand therapy most frequently involves a lot of home work on the patient's part. They're seeing the therapist maybe once a week, but we expect them to be doing some type of treatment on their own, and we instruct them on that every day to get their hand more functional.
Great. Doctor, thank you so much for joining us this morning.
Thank you.
It's been a pleasure.
Pleasure's
You can
mine.
find all the information right there on your screen, or go to the website and you can request a service.